Before beginning to take blood pressure, you should know how to work your equipment.
Gauge dial, the bulb, and the air valve which opens and closes. Earpiece, bell.
Now we are ready to take our own blood pressure. Be sure you are in a comfortable seated position and have your equipment gathered in front of you. Make sure everything is functioning properly. Before putting on the blood pressure cuff, be sure to locate the brachial artery. The brachial artery can be found by placing your index finger and middle fingers on the inside portion of your arm, just above the elbow crease. Now you can put the blood pressure cuff on your desired arm. Make sure that the arrow is facing towards where you palpated the brachial artery. Place the blood pressure cuff above the upper arm. Make sure it is snug and fitted evenly, with the bottom edge 1/2 inch above the elbow. Now you will get your stethoscope and put it on. With the earpieces in your ear, be sure that the earpieces are in snugly and that you can hear by tapping slightly on the bell. You can now place the bell on the brachial artery. While holding the bell to the brachial artery in the hand without the blood pressure cuff, you will hold the gauge in the other hand with the dial facing towards you. You will then begin to squeeze the bulb until you reach about 200 on the gauge dial. After you reach about 200 on the gauge dial, you will begin to slowly open the air valve, turning it counterclockwise. You will continue releasing the air slowly until you hear the first sound, which is a systolic pressure. This is the top number in blood pressure, which measures the pressure in the arteries when the heart beats or when the heart muscles contract. Continue releasing the air until there is no more sound heard. This is the diastolic pressure, or bottom number in blood pressure. It measures the pressure in the arteries between heartbeats when the heart muscles are relaxed. You can now release the remaining air in the valve. You can now remove the blood pressure cuff and your stethoscope. You can record your results. This completes measuring your own blood pressure. If you have any questions or concerns, please consult with your doctor or healthcare provider.